So good afternoon, everyone. So now I have given a role of this most difficult part of the session, that is the survivorship. And I must admit that this survivorship, in at least in India, is still in a very infancy stage. But as I will show you in the slides, definitely there is a need of a cancer survivorship program in our country. So why there is a need of survivorship? So the answer is the cancer cure rates are increasing. So let's come to the fact. This is the data of the US, where the all cancer sites, the incidence or the cure rate of different cancer has been in the 1975 to 77 and compared to the 2008 and 14. So if we compare the breast, the survival rate was in the around of 75%, where in the current era it's reaching up to 90%. Definitely we are not at this stage in our country, but still we are aiming around 70-75% in current era. Similarly, for the colorectal, the cure rate is increasing to 60%. That means out of the 100 patients which have been diagnosed, around 2/3 are being cured with the current cancer treatment. That means the number of cancer survivor is going to increase in due course of time, and we have to understand this fact that the number of cancer survivors are increasing. Coming to the next slide, this is the chart showing the total number of cancer deaths that were averted from 1991 to 2016. So the upper red line is the curve shows that if the no effective intervention was done, the number of deaths with overall death with the cancer, and the blue line. So the difference from the red to the blue line, that means around 1 million cancer patients have been saved. Similarly, in women's around 0.8 million patients have been saved of their life. That means the patients have been, cure rate has been increasing, and more number of patients are becoming the survivor for cancer. So similarly, this is the US data, the expected cure rate. Coming to the all site, this is the expected survivor in US in 2019. Coming to the all site, the survivor rate is around 8 million in the male population and around 8 million in the female. So that means this number is going to be huge. If that same trend continues in 2030, the number of survivors is going to 10 million in the males and around 11 million. That means chunk of the patients. So in US population, what they are expecting, that out of the 3 patients diagnosed with the cancer, 1 is the cancer survivor, and this number is going to increase in due course of time because of the effective therapies, better understanding of the disease, better supportive care that is leading to the increased cancer care. So the fact is clear that the cancer survivor, the number of patients who are being cured is gradually increasing over course of time, and we are still not very much ready to handle this important problem. Similarly, this slide shows the percentage of survivor in 2019. So the initial year since diagnosis, the majority of the patient are still 33% are within 5 years of their cancer treatment completion, 5 to 10 year 23%. So this shows that as I again highlighted, the cancer. So as this number of cancer survivors are gradually increasing in our country, there is an urgent need of recognizing that cancer survivorship is next big challenge after completing the initial treatment for the patients. So the National Cancer Institute defines survivorship as the health and life of a person with cancer post-treatment until the end of life. So once the patient has been diagnosed or been treated with the disease, patient becomes the cancer survivor for whole end of the life. And the most important aspect that it not only covers the physical, it covers the psychological, economical issue of cancer beyond the diagnosis and the treatment phases. And the survivorship includes issues related to the ability to get health care and follow-up, treatment, late effects, second cancer, and quality of life. So it's not only the survivorship doesn't include the simple straightforward follow-up, but it also includes the late effect of the treatment, second cancer, and the quality of life these patients will have after their initial diagnosis and the cure of the cancer patient. So what are the need or the challenges that exist when implementing a cancer survivor care program? So there are various barriers, various needs, and this barrier or needs can be at the provider level, that is the primary cancer provider level, it can be at the survivor level, that is the patient level, and it can be at the community resources and healthcare delivery system. So there is some unmet need at every level, from the patient to the survivor to the community and to the healthcare delivery system. So the provider level challenge, I think the most important issue from health and care provider point of view is to understand that there is a need of survivorship program. So as a medical oncologist or as an oncologist, we should understand that the every institute must have a cancer survivorship follow-up program. Patients who are coming for follow-up after their cancer-directed treatment is completed, their medical and psychosocial need is completely different from an ongoing patient. That we, so the patient who has been cured for a testicular cancer, they are coming for follow-up in our OPD. They are waiting from morning to evening to show the even in a BG OPD we just want to see their tumor marker, their scan, and they send back. So the follow up of a survivor patient doesn't end with this. Only seeing the blood report is not the right care for these follow up patients. There are other issues, there are other psychological issues, there are financial issues that has to be addressed. So that means our perception as an oncologist should be changed towards the survivorship programs and the patient who are being cured on follow up. So there is an urgent need of survivorship OPD, especially at high volume cancer center. So there should be a dedicated place, as mentioned by the previous speaker. The patients who are being cured are not likely come to the same place because of the memory, because of the past memory. They don't want to come to the hospital to follow up. So possibly the survivorship OPD should be a different place so that the patient should not have to suffer from the trauma from that. And other important aspect from the survivorship OPDs from the provider level is that there is a need of specific manpower, infrastructure, training of staff, understanding the concept of. So I think the other important need from the provider level is that the concept of this survivor should be at the policy level maker, at the tertiary private cancer center, and head of the major cancer institute, so that all these should recognize that the cancer survivorship is an important aspect. It can't be continued with the existing infrastructure in OPD. There should be a dedicated infrastructure, manpower, and there should be a team to handle all the problems associated with the cancer survivorship program. So, like mentioned earlier, there should be a dedicated team member in the survivorship, which includes the treating oncologist, because the patient is being attached to that. There should be a psychiatrist, there should be a social worker, there should be a physiotherapist, occupational therapist, NGOs to address their specific need arising in those survivor patients. And the other important aspect from the provider level is that the treating oncologist should have some sort of liaison with the primary physician at the community level, because when the patient go back to their native place, they can't come for each and every problem to the tertiary care center. So the primary physician should be at least aware of the different need of survivors and the possible long-term complication associated with therapy. Suppose the patient of a breast cancer who develops congestive cardiac failure, some symptom of that, they should be aware that the drugs which he has received may have caused this. So some sort of liaising with the primary care physician from the provider level or the primary onco physician level should be with the primary care physician, so that the immediate urgent need can be addressed at the local place, and the survivor has not to rush for each and everything to the tertiary care center for small things. Other provider level challenges that the understanding that in the survivorship, the most important aspect of that the age and of patient and survivorship and follow-up investigation and psychological need is entirely different. So of survivorship follow-up program for a kid is a different, survivorship follow-up program for an adolescent is different, survivorship follow-up program for a breast cancer patient in early 20s is different. So the need for a survivorship program is to be based on the age of the patient, the diagnosis, what the treatment they have. It's not a one OPD which can cater for all the patients who is diagnosed. And the other important aspect that there should be age and disease specific follow-up is required to optimally follow these patients. As I mentioned, the follow-up protocol for these patients, for a survivor, is to be rationalized, is to be optimized as per the disease, as per the age, as per the psychological needs, and as per the strata of the society. So patient coming from a higher economic strata, from a upper class, may have a different psychosocial needs compared to the patients who are coming from a lower. So a team comprising of the psychiatrist, psychosocial worker is also very much important in providing the care for the follow-up. The point of view or need from the patient level challenges is that whenever any patient has been diagnosed, If the patient receives only early stage of the disease, received only radiotherapy or only a small dose of the chemotherapy, as a physician, we have to inform them that there is a need of our follow up these patients, even though they have received a minimum treatment, but theoretically they can develop some complication. They are required to come to follow up as per the scheduled plan given to the patient. And ideally, when we see these patient, whenever we talk to the patient, we should involve the family members also, because when the patient might not be able to come to the follow up because of the social reason, because of the psychological reason. So whenever we discuss with the patient regarding the follow up schedule, regarding the survivorship plans, the family and the other caregivers should be involved, because ultimately if the patient is not willing to come because of that, the family member or the caregiver should involve or should ensure that the patient should come for these follow-up or the other issues which can be patient can face while on the follow-up. That needs to be informed to the patient and their caregiver, that this patient may develop this complication, may develop this problem. So this message should also given to the survivorship message should also, the family member and caregiver should also be involved in the part of the any survivorship follow-up program. And the information regarding the appropriate follow-up has to be given into the level the patient under. Patient coming from a poor socioeconomic strata, patient coming from a higher socio, they have a different cultural aspect, they different language, they different educational level. So all these has to be addressed from the patient perspective and should not be a one general blanket for all patients. And this follow-up care for survivorship is a dynamic. So as mentioned earlier, as the patient age increases, their psychological aspect, the social need, their financial aspect, all changes over course of time. So the care plan must be flexible to assess and address changing need of survivors in due course of time. System level changes, definitely there is a lack of standardized guidelines. The patient's ability to come to the tertiary care center for follow-up survival is different. They might not get the leave for the coming. They have a financial problems for coming to the tertiary care center for this follow-up. So the system should also be, the sensitization of the system should also be there, that these patients who are being cured may require a different level of approach, may require a different level of the treatment from the society than the normal patients. And the most important aspect in our country is the financial challenges, which we have seen in patients, that the survivors with a multiple death effect may be unemployed or underemployed, therefore may not be able to sustain their livelihood. A lack of resource may limit their ability to provide to deliver the robust survivorship care. So the financial issue burden further complicates the guilt and psychological trauma. So it's a vicious cycle of the guilt, psychological trauma, the financial aspect. So the financial challenges, which is very important in our country, needs to be taken care in this survivorship program. So patients who have been cured, so we have to ask whether they have been, after their treatment completion, have they gone back to their work? Are the company which they are working are ready to accept them or not? Is there any issue in accepting the
Excuse me,
patient?
Dr. Amit, the time is out. If you could
just I'm summing. So in coming to the take-home message, the treating oncologist institute has to understand that they accept the urgent need of survivorship program. Follow-up plans of survivor care are varies as per the age. They also need to understand that the follow-up these programs is different than the ongoing patient. This is very important. The survivorship should not be done along with the ongoing patient. There should be a different place, different teams managing the survivorship. Patient need to provide information. Role of NGO is very important in overcoming these issues. Vocational training program and placement of job of all is utmost important from the financial aspect, and need of cancer survivor in terms of financial and social aspect has to be understood by the government and the private institution. And treating oncologist has to accept that this has to be done on urgent basis, and follow-up program is changed as per the age and disease, and they are also. So in the end, what I would like to that as a treating oncologist, our job doesn't end after completing the treatment and curing the patient. Instead, long-term follow-up and survivorship is as important as the initial treatment of the patient. And like in US, there is a national coalition for cancer survivorship. Definitely our country, in due course of time, I say from even now needs this site of cancer survivorship. They have a yearly program reports for the National Coalition for Cancer Survivorship, and even they have maintained a cancer survivorship e-learning for primary care provider. So I think now there's a time that we should also develop our own cancer survivorship program like in the US. Thank you for attention.